quite quickly.
Right. Do you remember this photo of your day of surgery? This is what you actually looked like, and I can tell you're getting some growth already. Okay, so probably about 10% of the hairs are starting to wake up now, so it's still early days, but I can definitely see an improvement already.
Yeah. And this is actually something that I was just thinking yesterday when I was after shower, that my hairline is much better now. It's definitely not like this anymore. So yeah, really exciting.
Now, one of the other things that we check up on our first checkup with all our patients, Mikko, is the donor. So let's have a little turn around. So the donor all looks fine and a little bit red still in that little section where we harvest the hair. But as you can see, it's healed up nicely. Nothing to see.
Yeah, my skin is something that gets really easily red as well. I just touch a bit,
Which is, it's very, very hard to tell because I'm flicking through your hair and looking at your scalp right now.
Yeah.
So it looks really, really good and natural. You back to work? You had no problems?
No, probably the first 3-4 days I had a little bit of swelling on my forehead, but that was really only downside. Obviously the hair needed to grow back kind of over any of the scabbing and things at the back.
Sure.
So that took a little while, but I was back to work the next day. But obviously it was a little bit obvious then. But,
what do you think the process was in terms of pain? The operation, was it as you expected?
Pain, I wouldn't call it pain, so discomfort definitely when the anesthetic is put in. So a few needles goes in here in the morning, and the back of my head is numbed. It's not nice feeling, but only maybe 2-3 minutes it takes, and then you don't really feel anything. So that was that. I was sleeping during the morning, so obviously really relaxed.
Sure.
And then the implantation in the afternoon, same thing. I don't like the needles at the start, but then I don't feel anything after that. So
we try to make it as painless for our patients, and obviously they feel pain dependent on their experiences and their expectations. So if you expect a lot of pain, you'll probably feel a lot of pain. But you had a great donor and a great hair transplant, so I'm sure you're going to get a great result.
Yeah, and I probably didn't expect too much pain because I've seen a lot of people obviously going through, although this was my first time doing it.
And it's so important to inform the patients and make them understand the process so that they won't be anxious and then feel more pain.
Okay. Yeah, but thank you so far. I've been really happy but excited obviously.
What treatments are you doing for your hair to get better results and prevent further hair loss?
I am doing probably about 10 days after the surgery. I started using minoxidil on my frontal hairline, and then just about a week ago I did my first growth factor therapy session at the DHI clinic, and that's what I'm gonna do now every month.
And that's PRP?
Yeah.
Excellent. And that's going to stimulate new growth, further growth, and hopefully prevent further hair loss.
Yeah, well, that's the idea. So it's not only on the frontal area; it's kind of the whole top where it's hoping to get a bit of strengthening of all the hairs.
And that's what we find with some of our patients. Their hair in non-transplanted areas even looks thicker and healthier.
Yeah.
Excellent.
Thank you.
So Mikko, we'll see you in about 4 months.
All right, perfect. I'll be back.